Hi, welcome to my final video on ECG interpretation. This video is going to be slightly different to the last three because we're going to cover the sequence in which you need to approach the ECG. So in the first video we covered cardiac conduction. In the second video we looked at abnormalities, particularly conduction problems, and then we moved on to supraventricular and ventricular problems. We finished off with other abnormalities in video 3, which included atrial fibrillation, ventricular fibrillation, and then we covered bundle branch block and cardiac axis. In this video, we're just going to talk through the sequence quickly so that you can apply what you've learned in the other three guides. And if you've not seen the three guides already, then make sure you check them out at AskDrSham.com. So we're going to start with step 0. So step 0 is the first stage of interpreting an ECG, and what you want to do is identify that you have the correct patient's details in front of you. So look at their name, look at their date of birth, look at their hospital or NHS number, and then you also want to look at the date and time that that ECG was performed. Step 1. Step 1 is calculating the rate of the ECG. So if you go back to ECG Guide 1, you will see that there's two methods. The first method is the crude method, in which you take the number of big squares between the two R waves and then you divide 300 by that number. So if it's 4 large squares, then it's 300 divided by 4, which would give you a rate of 75 beats per minute. Alternatively, especially for irregular rhythms, you can use the other method, which is more accurate. That method involves measuring 30 big squares on an ECG, and then you count the number of R waves between that sequence, and then you times that number by 10. So what you're looking at 6 seconds on an ECG, and then timesing that up by 10 to give you how many beats there are in a whole minute. Step 2. Step 2 involves looking at the regularity or irregularity of the rhythm. So all you're commenting on at this stage is whether the rhythm appears regular, irregular, and if it appears irregular, is it regularly irregular or is it irregularly irregular? So one of the things that you're looking at here is look at the sequence and look at whether the sequence is repeating itself. So if something's like AF, then it's irregularly irregular, or if it's something like Morbitz type 2, then it may be regularly irregular. Now we're going to move on to step 3. So step 3 is reporting on the cardiac axis. I talked about axis deviation in ECG guide number 3. So all you need to do is recap onto that. Essentially what you're looking at is whether the R waves are pointing towards each other, which would represent a right axis deviation, or if they're going away from each other, then it represents a left axis deviation. Step 4. Step 4 is to comment on the P waves. So what you want to look at is a P wave present? Representing or finding that P wave is so important because it helps determine what type of rhythm it is. If there's no P waves present, then we know that there's a problem with atrial conduction, or it's being overrun by the ventricles. We also want to look at whether each P wave is followed by a QRS complex, because if it isn't, then we know that there's some failure to conduct down to the ventricles, so that could be a problem within the AV node. And then you also want to think about whether what the sequence is. So is there a set number of P waves before you lose a complex or not? And then you want to think about morphology of a P wave. So when we talk about morphology, we talk about specific patterns of the P wave. So is it a peaked P wave or is it a bifid P wave? And I go through this in ECG video 3. The other thing to remember about P waves is there's some particular patterns that you can get, like a sawtooth pattern, which will be present in atrial flutter. Step 5. So step 5 is all about the PR interval. So the PR interval, if we go back to cardiac conduction in series 1, the PR interval represents how long it takes to get from the sinoatrial node down to the AV node. So the normal measurement is between 0.12 seconds to 0.2 seconds. So that's between 3 small squares and 5 small squares. So if it's prolonged, why is it prolonged? Is it prolonged? So is the prolongation the same every time? So if it's prolonged, then you're thinking maybe a kind of type 1 or first degree heart block. If it's prolonged at different levels, then is this a Mobitz type 1 picture, such as the Wenckebach phenomenon? So that's why you think about the PR interval. There's lots of information on the PR interval in the ECG Guide 2, where we talk about conduction problems at the AV node. Step 6. Step 6 is all about the QRS complex. So what we're thinking about here is the QRS complex normal? So when we talk about normal QRS complex, we want nice and narrow QRS complexes, so less than 3 small squares. If there's a problem within the QRS complex, is it because there's a problem within the ventricles? So if it's broad, that can be a presence of ventricular tachycardia. It may also be enlarged due to left bundle branch block or right bundle branch block. And then when you look at the QRS, you want to look at the shape of the QRS. So when we talk about bundle branch block, we talk about RSR waves. And the RSR wave presents as an M. So if it presents as an M, where is that M? So if the M is in V6, then we know it's left bundle branch block. If the M is in V1 or V2, then it's more likely to be a right bundle branch block. And what we also have to think about is, are there any other abnormalities within the QRS complex? So for example, when we move on to step 7 is the ST segment. So when we're talking about the ST segment, it's moving on from the QRS shape. So with the ST segment, is it depressed or is it elevated? And if you go back to our guide on ST elevation or depression, you'll know that ST elevation is so important. If it's present, you want to comment on it. Could it be a sign of pericarditis? Could it be a sign of ischemia? Has a myocardial infarction taken place? So that's why you comment on ST elevation. And when you're commenting on ST elevation, remember that you're talking about it in line with which area of the heart is being affected. So if you go back to ECG guide number 1, you can see all the information about where the heart's being affected. And then we're going to move on to step 8. So step 8 is talking about the T waves. So when we talk about the T waves, we talk about, are they inverted? So if a T wave is inverted, it could be an old change. So it's something that's been there chronically, such as kind of if the heart's become ischemic over time. It could also be an acute change, so it could be synonymous with chest pain, and if so, then it could represent a myocardial infarction. And then you have what's called T-wave tenting. So if you have T-wave tenting, that could be a sign of hyperkalemia. And in ECG guide number 3, I talk about the 4 different signs on an ECG for hyperkalemia. And then finally, to summarize, we have step 9. Step 9 is talking about the QT. So the QT or the QTC when it's corrected. What you want to be able to do is comment on whether the QTC is shortened or prolonged. And if it's prolonged, you want to think about why it's prolonged. So if somebody has long QT syndrome, do they take certain medications which could prolong the QT? And that increases their risk of going into an arrhythmia, such as ventricular tachycardia. So it's really important to comment on the QT. And if you're working somewhere like psychiatry, that's often the main area of importance for the ECG. So that's my step 0 to step 9. I hope you found it interesting. I'll just summarize it quickly so you can go through it really quickly. So step 0, identify the patient. Step 1 is calculating the rate. Step 2 is talking about the rhythm. Step 3 is talking about the axis deviation, if it's present or not. Step 4 is talking about the P waves. Step 5 is commenting on whether the PR interval is normal or abnormal. Step 6 is talking about the QRS complex. Step 7 is talking about the ST segment. Step 8 is talking about the T waves. and step 9 is talking about the QT. If you use that approach in line with what we've learned from guides 1, 2 and 3, you should be able to master how to report an ECG. I hope you found this guide helpful. If you have, please share it with your colleagues. Thank you.